Good morning. Welcome to the University Unitarian Universalist Fellowship of Orlando. I am Beatrice Reyes Foster, and I will be your service leader today. Greetings to everyone on Facebook and on YouTube, and a special welcome to any new visitors, be they online or in person. Please take a moment to silence your devices wherever you are. Now is our time for committee moments. I ask any committee representatives with information to share to join us at the microphone.
Kelly's catching up with me because she's done a lot of the work. So you all know, I hope, that today is the Christmas potluck. So everyone's welcome. You didn't hear the announcement when I made it last week, and you didn't bring any food? No problem. Please come. You're a first-time visitor, you didn't bring a dish? Please come. We want everybody who's here to stay and enjoy the meal with us. The next thing is that we do need some people to help with the setup and breakdown. So could a couple people raise their hands who's willing to work on the setup? Okay, and the breakdown. Thank you. Okay, so we need to get those two things out of the way. Just remember who you are, and the dishes look great, so I think we're going to have a good potluck. And I'd like to thank Larry for the remains of his birthday feast, because we have a lot of that. And bring your sweet tooth, because being Christmas, we have a lot of sweets. Few things is when we do set up, we're going to ask everyone to go down the hall to the far door, enter into the area, and then work your way this way. There's 2 lines. Pick both lines. We're going to do people who need a little extra help to go through first, and then people with children, and we're asking that adults go through with their children. Okay? Then everybody else will be after that, and I think I got it all covered. So, looking forward to the party.
Thank you.
Hi, Carrie Mitchell with Religious Education. Just to sort of piggyback on that, we are short-staffed in religious education today. We do not have childcare. Once service is over, you're going to need to come get your kids, and they will be your responsibility. We will not have anybody to watch them on the playground if they get restless during potluck. Sorry.
Paula Despang for membership. Margie asked me to tell you that next week, after the service, we welcome all of our visitors, and even members if they want, to attend UU 101. We'll talk about Unitarian Universalism, this particular congregation, and get to know each other a little bit better. Hope to see you there. So.
Hi, Lindsay Stroh from the Auction Committee. We will be having a meeting this Thursday at 7 o'clock on Zoom. If you're already on the committee, you'll receive a Zoom invitation. If you'd like to join, let me know so that I can send you the invitation. Mark your calendars, because we do have the date for our auction where we'll be sharing our time, treasures, and talent on April the 16th. That's a Sunday. After church, we'll have a luncheon and an auction and a lot of fun. April 16th.
Joey Cole for SAC. I see that the donations to the Knights Pantry box are filling up. Thank you so much. We are collecting until the end of this month for Knights Pantry at the University of Central Florida. And I also see that our bag of toys is getting filled up. I also have an entire carload, which I had to take out last night because I had both my husband and Remus to take home. Didn't have room in the car. So I will be making the trip to Apopka this week. These toys, in case you didn't know, some people got confused because there's 2 Hopes. There's Hope Helps at Oviedo. That's not who we're collecting for right now. We are collecting for the farm workers from the Hope Community Center in Apopka. What we needed were unwrapped toys. So if you haven't done it, that's fine. We have a ton to take out there this week, and that's exactly what we will be doing. If any toys come in late, I will take them to Hope Helps in Oviedo. That way they will get donated. Okay? Let me see. I'm trying to think if there's anything else. I don't think so. We have a SAC meeting next week. Oh, one thing. I don't know if anybody else was here for the cleanup last night, but I'm cheap, and I brought my Christmas cards for certain families, and they were not here because I wanted to save a stamp, and I left them. So if you don't get my card, it probably just got left at Larry's party. Sorry.
Hi, Janet Levins, choir director. I'm really excited. We're going caroling this afternoon, and we're meeting here at 1 p.m. You're all invited. It's going to be fun. We have 13 people signed up, and we have a limit of 20 people, so we can have 7 more people come. Okay, just letting you know. So, I'm looking forward to it.
John Mowbray on behalf of Facilities and Grounds, and next Saturday is a work day, so if you can come out between 9 o'clock and 12, please do. Bring your talents if you like to do stuff inside or you like to do work out in the fields. Please come. We can use all the help you can spare. All right, thanks. 9 to 12 next Saturday.
Good morning, Kelly Buchanan with the Marketing Committee. Just a couple of updates. You know, a part of what we're doing this year in terms of marketing is really trying to reach out to our community, especially UCF. And I've got 2 different initiatives to report. One is today we have a gentleman that's going to be here at 12 o'clock. He's a UCF student in film school, and he actually reached out to us to try to use our space as a shooting space for his short film. The film is going to be based on, I think it's an AA meeting, actually. So we're really excited about that. If you see Derek or John or myself walking around with the UCF student, that's the reason why they're going to use our space for a shooting. The second thing is that we actually partnered with UCF in terms of their onboarding orientation initiative. You know, when new students come through to become a new student, they get a magnet with a lot of 911 or all the emergency care, but they had one spot for a church. So they reached out, so we were going to be on the magnet. So so we're going to be on the magnet, hopefully on the refrigerator. And so we're working on the, the content and what to say on that magnet. But so stay tuned. So we're reaching out. Thanks.
Morning, everyone. Michelle Flores here for the women's group. So we are working on improving communication and forms of communication, and we are going to start doing first Friday of every month. So Friday, January 6th, we're going to do here at the church, and we're going to do vision boards. So thank you.
Thank you so much. My opening words are from Dr. Paul Farmer. To pull 1 million people out of poverty in the last several years, to build stable institutions where none existed. To me, that is about hope, and it's about rejecting despair and cynicism. Those are the 2 biggest dead ends we've got, despair and cynicism. Our opening music is Angels We Have Heard on High. Hymn 231 in your hymnals if you have them. Please stand in body or spirit.
Body or spirit.
Sorry.
Echo
Our chalice lighter is Anastasia. Anastasia uses she, her pronouns, and she is 9 years old. And her joy is that she roller skated around UCF last night. Great place to roller skate. In the light of truth and the world of love, we gather to seek, to sustain, and to share. And together, we make our affirmation. Love is the spirit of this church, and service is its gift. This is our great covenant, to dwell together in peace, to seek truth and love, and to help one another. At this time, let us take a moment to welcome any guests to our congregation today. We have a part-time minister who comes a couple of times a month, but we also have a wonderful lay-led tradition. We generally ask that you visit us at least 3 times to get a full flavor of what we're all about. We have varied speakers, from community leaders to academics to members of our own congregation, and our topics vary widely, from the very academic to the very spiritual. So please come visit us a few times. And now let's take a moment to say hello to your neighbor. I love hearing all those voices. Except maybe that one. No, joking. Now is the time when we share those joys of concerns which impact us deeply, inspire us, or raise our spirits. We invite those who wish to speak to come up to take the microphone.
Yesterday we had Beacon, Somaskaka, which is basically all the winter holidays combined, and we decorated all the cookies for the potluck, and yeah, it was really fun.
I should have made this announcement during committee moments, but it is a joy, so I'm going to use it as a joy. We've got January covered by the parent support group for coffee prep in January. Thank you so much. And the men's group is covering February, and Amy Mowbray said she would help me, and we're going to cover March. So we've got the first 3 months covered, and Maryland, London. Okay, so that doesn't let the rest of you off the hook. We still need people going forward. Okay. On a more serious note, I just found out yesterday that my brother is going to be going into hospice. In some ways, it is a blessing. It is better for him to be there than where he is right now. And it may take some time, but he is not living the life he would like to live with Alzheimer's. And so I'm just hoping that he's comfortable and that it's quick. Thank you.
Hello, my name is Ender, and I'm trying to start a D&D club here at church, but I have a concern that we need a sponsor and an adult to help us out. So, please come and help. D&D is a role-playing game, and it is called Dungeons and Dragons, but most people call it D&D.
I'm Anastasia, and last night while the boys were at Semastica, whatever that is, I went roller skating at UCF, and it was dark outside.
So I'm Melanie, here for an update about our 16-year-old who broke his arm a few weeks ago. So I think I mentioned he had surgery. He had his first post-op appointment, and he got the splint off. And he's healing very well. He's still in the sling, which he only has to wear in between classes, so that maybe hopefully people will try to stay away from him. He did mention that sometimes people bump him, but just by accident. It's just a lot of people in a small space, just when you're changing classes in high school. But otherwise, he's doing great. He's not in any pain. So we're happy about that. Just waiting for him to fully recover, and then he can start driving himself back to and from school and wherever else he wants to go. I know he misses his friends as well, but otherwise, he's doing great.
Hi, I'm Karen, and I have both a joy and a concern. My joy is that I worked very hard to play the games to get the companion pass that you can get with Southwest. That means this little one flies free for me. And it's been a big, generous gift that we are flying everywhere. And the second joy of that is that I just decided we were going to go Denver for Winter Wonderland for him. So we're so, so excited. And then the joy just got multiplied. A friend who lives there said, well, please come stay with me. Oh, and by the way, you can have my car. I'm like, oh my goodness, thank you. This is fantastic. Fantastic. And my only little hiccup is concerned is that I'm from Florida and driving in snow. But I'll get past it. We're just so joyous. We're just so joyous. So.
Okay. I don't know. Oh.
You all are encouraging him. Let us take a moment of silence to honor the joys and concerns that remain unspoken. Thank you. Now it's time for all ages. And I'm actually not sure who will be giving time for all ages today. Do we have time for all ages today? This is interesting, yes. I do not see Martha here. Huh. Well, this is a first. Let's keep going. We are a generous congregation, and it is time for our interlude and offering. Each month, we dedicate 40% of our plate offerings to a worthy organization. And this month, we are dedicating our plate offerings to the ACLU.
So this hymn was written by a Unitarian Universalist, so it's kind of part of our tradition. And I'm not here to sing a solo, so please join me. It's number 244 in the hymnal. I haven't practiced, so please just join me. And stand if you feel like, or just sit down. Came upon a midnight clear, that glorious sun.
And now we will sing our children out. We love you and bless you and send you on your way. We love you and bless you today and every day. As we move into the annual season of giving, there are few among us who have given more to the world than Dr. Paul Farmer. A renowned anthropologist and global health advocate, Dr. Farmer was co-founder of Partners in Health, which collaborates with governments across 11 countries to bring quality health care to those most in need. The Partners in Health website states, Paul taught all those around him the power of accompaniment, love for another, and solidarity. He passed away earlier this year. Triple UF member and fellow anthropologist, Dr. Marilyn Stewart Kelch will share more about his life and work. Welcome.
Thank you, Beatrice. I'm really glad to be here, and I thank Barry for serving as my understudy today, if the fates had been different. I want to say that my talk was first given in a smaller version for inquiring minds. I talk about development or applied anthropology. And I have to say that I'm not an applied anthropologist. I'm an archaeologist. My degree is in anthropology. I only know about applied anthropology secondhand. And I'm very happy to say we have a first-hand medical anthropologist here, and that's Beatrice. So if you have any questions, ask Beatrice. Also Barry, because he was prepared to be standing here today. Okay, and I do look forward to hearing more from Beatrice about her work in the future. I'm going to read this because it goes better that way. It doesn't take as long. Oh, and I didn't bring up the, I need the remote. It's in the first pocket of the The world lost a great humanitarian in February 2022. Paul Farmer was a medical anthropologist and doctor specializing in infectious diseases who changed the practice of public health throughout the world through his vision of global health equity. The principle that every person has a right to quality health care. He believed that there are enough resources in the world to fund the providers, medicines, and loving care for even the poorest patients. And it was his job to see that these resources are made available to them. He died at 62 while teaching at the new medical school in Rwanda, one of many material proofs of his vision. Farmer's professional base was Harvard Medical School, where he chaired the Department of Global Health and Social Medicine. He was also attending physician at Brigham and Women's Hospital and ran a clinic in Roxbury. His family home was Haiti, where his life's work began. I was introduced, so to speak, to Paul Farmer through Tracy Kidder's 2003 book, Mountains Beyond Mountains, The Quest of Dr. Farmer, a Man Who Would Cure the World. Kidder spent 2 years following Farmer over the hills of Haiti and around the globe in 2000 through 2002. The book tells Farmer's story from his childhood through the early years of the great nonprofit he co-funded in 1987, Partners in Health. Paul Edward Farmer was born in North Adams, Massachusetts, second of 6 children. 3 boys and 3 girls. His salesman father took the family to Birmingham, Alabama, when Paul was about 7, and later to Brooksville, Florida, where Paul spent his teen years. His father taught school and worked with intellectually disabled adults, while his mother cashiered at Winn-Dixie. The family lived in a bus in a trailer park, and later moored on a houseboat in a marsh. That was his upbringing. Paul's lifelong devotion to what he called the poor, because that's what his patients called themselves, had its roots in his own childhood experience. Paul was a gifted student and president of his senior class. He went to Duke on a full scholarship, where he discovered medical anthropology and met a Belgian nun who introduced him to the lives of Haitian farm workers in North Carolina. After he graduated summa cum laude in 1982 with a $1,000 prize for an essay about Haitian artists, he spent a year in Haiti working in clinics and learning the language and culture. I have to think of this is backwards. I have to think about it every time. When Paul started medical school at Harvard in 1984, he had found his life's work in a rural village called Cange. With the blessing of Père Fritz Lafontaine, a Haitian Anglican priest who ran a clinic in nearby Mirabelle, I hope I'm pronouncing these right, funded by an Episcopal diocese in North Carolina, Paul began with a survey of the health needs in Cange. Commuting between Cambridge and Cange, Paul worked with Père Lafontaine, developing a plan for a public health system, starting with a staff of community health workers to administer vaccinations and education, and building clean water systems, then building a clinic, a school, and eventually a hospital in this rural Haitian community. The vision became reality in 1987. Still in medical school, Paul and 3 friends founded Partners in Health with $1 million from a philanthropist with an interest in Haiti, who continued to maintain the fledgling nonprofit through the first 10 years. A few years later, in 1993, a MacArthur Genius Grant of $240,000 funded a new Institute for Health and Social Justice at Harvard. Partners in Health is dedicated to 2 fundamental principles. First, that every person has a right to quality health care. And second, that no life is worth less than another. In Haiti, that means that HIV/AIDS patients have access to and support in using the best retroviral drugs. Paul refused to believe that people are poor because of their personal or cultural faults. They are poor because wealthy nations have exploited their labor and their wealth and continue to deny them access to the same abundant resources enjoyed by the rich and powerful. He's not talking about communism. The solution is people showing up, making house calls, and partnering to build health systems that will be maintained by local residents. I went backwards, didn't I? That's not what it's supposed to be, though. Paul's life changed in 1996 with his marriage to Didi Bertrand, the most beautiful woman in Cange, who then went to Paris to study medical anthropology. In that same year, Partners in Health took on a project to treat patients with multi-drug resistant tuberculosis in a shanty town called Caraballo near Lima, Peru. Partners in Health had to convince Peru that the problem even existed. The country was very proud of the system they had built with the help of the World Health Organization, under whose protocol for treatment of the poor, which involved multiple rounds of standard drugs, which ended up causing multiple drug resistance. PIH found that patients who failed to get better either died or went home to spread multi-drug resistant TB in rural villages. Paul's clinical trial proved that treatment with second-line drugs cured 85% of these patients. Because MDR-TB is a massive global threat, his work began to garner international attention. After 2 years of advocacy in global forums, including as many trips to Paris as possible to visit Dee Dee and their daughter, and because of help from Doctors Without Borders to get drug companies to reduce prices for the expensive second-line drugs, who changed its prescription for treatment of MDR-TB? PIH received $45 million from the Gates Foundation to wipe out MDR-TB in Peru, and Russia received a World Bank loan for MDR-TB treatment in prisons. And I could have said a little more about Paul's involvement in the Russia case. Okay, next one. Nope. And then Tracy Kidder's book came out in 2003, and Paul Farmer became famous. PIH was now established as a major health nonprofit with multiple funding sources and a solid home base at Harvard. And Paul Farmer's vision of global health equity was several steps closer to acceptance. Everybody has trouble with this. Okay. Partners in Health continued to grow throughout the world and now has clinics and hospitals in 11 countries. And you see that when I gave this talk in February, Russia was one of those countries. Not anymore. Primarily in the Americas and Africa. Programs include HIV/AIDS, maternal and child health, TB, Ebola, cholera, cancer, diabetes, and since 2020, COVID-19, and mental health. The core of PIH programs has always been community workers making house calls and outpatient clinics providing free care. In 2013, Paul's dream to take it to another level was fulfilled with the opening of a teaching hospital with fully modern equipment and facilities in Miribelais. Students are trained in surgery, pediatrics, internal medicine, specialist nursing, management, and emergency care. The hospital was built in 18 months at minimal expense by local workers with technical assistance from volunteer professional carpenters, plumbers, and electricians from the U.S. I like that little slogan that's on their donation page. We go, we make house calls, we build health systems, we stay. What does the future look like now without Paul's superhuman presence? PIH from the beginning focused on building a nonprofit corporation and local health systems that would be replicable and sustainable. The facilities, personnel, and policies Paul Farmer developed will carry on his work, saving and improving lives among the most vulnerable communities throughout the world through a systems approach that incorporates all aspects of a patient's life into attaining and preserving good health. The three main facets of this approach are partnerships, health systems, and training. Partners in Health works through partnerships with governments, churches, academic institutions, medical experts, local community leaders, and donors. Related to partnerships is the concept of accompaniment. Community workers, nurses, and doctors work closely with their patients in long-term relationships, ensuring that their treatments are continuing and effective, and that they receive additional support that they need, whether it be food, tin roofs and concrete floors, money for transportation, or eyeglasses. Paul would climb up and down mountains for 4 to 5 hours, one way, to find out why a patient had missed their clinic appointment. This was how he modeled accompaniment. Of course, the man never slept. PIH clinic and hospital systems are built to endure and thrive with well-trained staff, proper medications and supplies, facilities with adequate space, electricity, and running water, good management and financing, and social support, including basic necessities and resources. A large part of PIH programs is training of community workers, of patients, of school children, but also of medical students from Harvard and increasingly of local nurses and doctors. Now PIH has a new medical school and teaching hospital in Rwanda. The University of Global Health Equity offers a Bachelor of Science in Medicine and Surgery and a Master of Science in Global Health Delivery. The combined program is their medical school program. The inaugural class of 2025 includes 20 women and 10 men, all from Rwanda. Farmer was supervising second-year clinical rotations there when he died. This is a selection of the many works by Paul Farmer, many medical journal articles, as well as you can imagine. His latest book is Fevers, Feuds, and Diamonds, primarily about Ebola. When Paul Farmer started out to provide quality health care to the most vulnerable people in the poorest places in the world, professional infectious disease experts said it couldn't be done. You couldn't expect AIDS or TB patients to take their meds reliable and endure the often nasty side effects, at least in the case of MDR-TB. They said, people do not know what watches and clocks are. They said, Africans must learn to curb their sexual appetites. They said it was not cost effective to treat poor people with expensive retroviral HIV, AIDS, and second-line TB medications. Paul Farmer proved that where there is a will to extend the benefits of quality health care beyond the United States and Western Europe and the wealthy enclaves of the developing world, it can be done. What can we all do to further the cause of global health equity? 3 things: donate, advocate, and volunteer. Haiti is in especially dire need right now after the assassination of President Waz in July and another earthquake in August. With the country in chaos, people are struggling to survive out-of-control violent gangs. Cholera, which was introduced to Haiti after the 2011 earthquake by UN peacekeepers, is rampant again. Donate to PIH or to Doctors Without Borders, for instance. Write letters to the editor and to your congressmen and senators in support of House Resolution 1373, establishing a policy of global health equity. And that was introduced in September in honor of Paul Farmer. It's in committee right now, the Foreign Affairs and Judiciary Committees. So write letters. Take a look at partnerinhealth.org, PIH.org, resources for global health advocates. Volunteer at a local healthcare nonprofit. And these are what I found in looking for healthcare nonprofits. One I found in particular that seems to really encourage volunteers is Hope and Help. And I have addresses for those 5 that I picked. Paul Farmer started a movement for global health equity that has impacted the UN, the World Bank, the government of India, and recently, the United States CDC, and there is their new policy for global health equity. His legacy will endure in the work of his colleagues, his wife Dee Bertrand Farmer, and the legions of medical practitioners he taught and inspired throughout the world. And there are many YouTube videos of Paul Farmer, many of them very long, as you can imagine. I found one that I particularly liked by Bill Gates, and it is called Paul Farmer, a Hero in His Own Words. And Patrick is almost ready to show that.
I knew I wanted to go into medicine. I had no idea why. Haiti made me know why.
Paul Farmer is that rare person who connects to a moral truth and devotes their entire life to helping those who need it and inspiring other people to come do the same.
There's this ongoing debate in global health about what is the cheapest intervention we can get that'll save the lives of most people. I'm so tired of hearing that. That shouldn't be the first question we're asking. Ask the question, what do you do if you're in a place like rural central Haiti, no electricity, no running water? Well, what if you have acute leukemia? And then you heard the litany. It's not cost effective to treat cancer. It's not sustainable. It's not feasible. Every school of public health teaches public health just the way I'm telling you. But there's more to medicine than saving 1 million lives at a time. How about this girl with leukemia in a squatter settlement? How about somebody save her life?
In Haiti, in Rwanda, his organization goes out into very tough places and they bring in doctors from the US, but over time they are training the local people and providing levels of health service that most people would say should be out of reach.
This is going to be a new hospital.
He innovated on how you can help an entire community even beyond their health needs.
Instead of having cultural competence, what we really need is cultural humility. Because if you have cultural humility, then you can say, you know what, I really don't know enough about this place.
In Haiti, Paul learned to speak the local language. And as we'd go to a new group, at the start, often somebody would give kind of a long thing and we'd sit there and wait for him to translate it. They were saying, almost certainly saying, hey, Dr. Paul, you saved our lives, it's incredible. You know, we're so glad you're here, you bring these new medicines, you train people. You know, he wasn't gonna pass that along, speaking about himself. So he would just say, obligatory praise. He wanted to get to the meat of, okay, what more can we do, and you know, let's hear that.
In 2010, there was absolutely zero emergency medicine training program in Haiti, none. So in the years since, every year we've graduated this team of urgent care people. Most of them are young women, and I saw them all over southern Haiti. It was just the most moving thing.
Well, there aren't many real heroes where the purity of their commitment and their way they articulate those values inspires, you know, millions of people. We'd all aspire to be like that, but very, very few are. That he died young. Well, I hope Paul's values and dreams stay strong, even without him here setting such a profound example.
I think once in a while we're all guilty of failing to underline how redemptive, joyous, positive this work is. If you follow some simple rules that I learned from the Haitians, every single one of your endeavors will be met with some measure of success. There is so much uncertainty in terms of outcome, but not in global health. If you follow these basic rules, people are going to get better.
I mean, you gotta love this job.
I knew.
Thank you so much. It is time to extinguish the chalice. We extinguish this flame. Our closing music is Jingle Bells.
I want to mention that the man who wrote Jingle Bells was a Unitarian, and he was music director of his church. He wrote it as a sleigh riding song. His town in Massachusetts had competitive sleigh rides, which were very popular, and it was written about Thanksgiving time. Had nothing to do with Christmas, but it has become a Christmas song.
Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. Margaret Mead. Thank you for joining us today. Please go in peace.